Hello everyone. Today let's discuss a question which appeared in NORCET 2023 examination. So the question goes like this. Contraindication of liver biopsy is. So the procedure which they are going to do here is liver biopsy, and the examiner wants to know in which conditions we are not supposed to do the liver biopsy. So what is liver biopsy? It's a procedure which is done under aseptic precautions where a part of the liver is removed for diagnosis of certain conditions like liver carcinoma. So the option goes like this. The first, we have diabetic condition of the patient. So what does it mean? So the patient on whom the procedure is being carried out is suffering from diabetes mellitus. So in a patient with diabetes, what can we expect? So the patient has high sugar levels. So it may be controlled or uncontrolled. So the high sugar levels in a patient makes him more susceptible for infections. So if we do liver biopsy in a patient with diabetes, the maximum risk we have is the patient contracting some kind of infection. Though it is done in a very sterile manner, the chances of the patient getting infection are very less. And even though if he gets certain infections, it can be treated with certain medications. So still, even if the patient is diabetic, we can still conduct a liver biopsy. So this option can be ruled out. Next we have decreased APTT. So what is APTT? APTT refers to activated partial thromboplastin time. Activated partial thromboplastin time. So what does it mean? So normally activated partial thromboplastin time ranges between 25 to 35 seconds. So it means within this duration, the blood of any individual gets clotted. So the option says decreased APTTs. It means the APTT or the clotting time has reduced from 25 seconds to less. So consider it is 20 seconds. So there is a decrease. So what does it mean? So if the clotting time has reduced, it means when the patient is bleeding, the blood gets clotted in less than the normal duration. So it is always beneficial because the bleeding time, because there is not excess loss of blood from the body. So hence this option can also be ruled out. Let's go to the fourth option. So it says immunocompromised patients. Again, in any patient who is immunocompromised, it means the patient's immunity is not strong. So immunity is weak. So in a patient whose immunity is weak, he is always prone to get infections. Since this procedure of liver biopsy is not going to introduce any infection into the body, the immunocompromised patient can also undergo liver biopsy. So hence this option can also be ruled out. The last option we have is increased APTT. So increased. What does it mean? As we have seen, the normal APTT is 25 to 30 seconds. 35 seconds. So if it is increased, so the duration can be more than this. So assume it is 40 to 45 seconds. Or still more, maybe 50 seconds. So if the clotting time increases, it means after the procedure of liver biopsy, there is increased chances of bleeding for a longer duration of time. The blood which is going to bleed for 20 seconds will be very minimum, whereas the blood which bleeds for for double the duration of the normal clotting time can result in excessive bleed into the intra-abdominal organs. So when the patient is such that he has a longer clotting time duration, so the liver biopsy cannot be conducted in such an individual. So the contraindication in these four options is in a patient who has increased clotting time. So as the clotting time is more, the patient is going to bleed more. So this is all about liver biopsy and the clotting time.